In this video, we will demonstrate how the HoverJack Air Patient Lift is used in the event of a patient fall to gently lift the patient in a supine position from the ground back up to a bed or stretcher height. For this video, we will be removing and inserting a HoverMat single patient use link and hover cover at the same time. This segment will train you on the proper use of the HoverJack Air Patient Lift, including how to log roll the patient onto the HoverMat SPU link, use a HoverMat SPU link to move a patient onto a deflated HoverJack Air Patient Lift, inflate the HoverJack Air Patient Lift, transfer from an inflated HoverJack Air Patient Lift to a bed using the HoverMat SPU link. The HoverJack Air Patient Lift system includes the HoverJack Patient Lift, a HoverJack air supply, and a cart. The air supply is used for the HoverMat SPU link for patient transfer and to inflate the HoverJack Air Patient Lift to raise the patient off the floor. The HoverJack Air Patient Lift has 4 inflation chambers. Each one has a black universal valve through which the air supply inflates the chamber. The valves are labeled and numbered from 1 to 4, with the chamber labeled valve 1 being closest to the floor. To close the universal valve for inflation, turn clockwise until finger tight. To open the universal valve for deflation, turn counterclockwise. For quicker deflation, make sure the universal valve is fully open. The valve will be visibly protruding from the HoverJack Air Patient Lift when open. To slowly deflate, press the center button of the universal valve. Always close these valves after using the HoverJack to ensure they are ready for the next use. The HoverJack has 8 perimeter handles, 2 at the foot end, 2 at the head end, and 2 on each side. There are 2 patient safety straps and a pull strap is located at the head end. The HoverJack Air Patient Lift has a Teflon-coated bottom to facilitate safe patient transport across the floor. The HoverJack Air Patient Lift is latex-free and has a weight capacity of 1,200 pounds. Two methods can be used to position a patient on the HoverJack Air Patient Lift. With either method, at least 2 caregivers must be present to perform a patient lift using the HoverJack Air Patient Lift. In this video, we will use the log rolling technique to place the patient on the HoverMat SPU link for transfer onto a deflated HoverJack Air Patient Lift. This technique is especially helpful if the patient has fallen in a hard-to-reach place, such as a bathroom. Secure as much of the HoverMat SPU link under your patient as possible with our log rolling technique. Tools such as pillowcases or extension straps can be looped through the HoverMat SPU link handles to assist with the transfer. Inflate the HoverMat SPU link and ensure your patient is centered, then move your patient from the fall site onto the deflated HoverJack Air Patient Lift. The patient's body must be centered on the HoverJack Air Patient Lift. Press the standby button on the air supply to turn off the airflow and disconnect the air supply hose from the HoverMat SPU link. Another technique is to position the HoverMat SPU link and HoverJack Air Patient Lift under the patient simultaneously. Once the patient is positioned on the deflated HoverJack Air Patient Lift using either of the described methods, you can begin the inflation process. One caregiver should be positioned at the patient's side to reassure the patient and monitor the lift. Another caregiver remains at the foot end to inflate the HoverJack Air Patient Lift. If another caregiver is available, they should attend to the other side of the patient. Check that the universal valves are tightly closed. Press the HoverJack button on the air supply to initiate airflow and begin inflation. Begin inflating the HoverJack Air Patient Lift by placing the air supply hose over the universal valve located on the air chamber against the floor, labeled Valve 1. To ensure that each HoverJack air chamber is fully inflated, watch the chamber inflate. The patient's body will stop rising when the chamber is fully inflated. Feel the chamber after inflation. The chamber should feel rock hard to the touch. When you have determined that the first chamber is fully inflated, move the air hose to the valve in the second chamber labeled Valve 2. Repeat this process until fully inflated. Continue the same process for air chamber valves labeled 3 and 4. It is important that each chamber is inflated in sequence for safety, starting with the chamber valve 1, which is closest to the floor. If chambers are inflated out of order, the HoverJack can become unstable. Once all chambers are fully inflated, press the standby button on the air supply to turn off the airflow. Next, attach the patient safety straps. Bring a bed or stretcher alongside the inflated HoverJack Air Patient Lift, or use the perimeter handles to slide the HoverJack next to the bed or stretcher onto which the patient will be transferred. Adjust the bed height prior to the patient transfer so that it is slightly lower than the top of the inflated HoverJack Air Patient Lift. Detach the HoverJack patient safety straps and insert the air supply hose into the HoverMat SPU Link hose intake closest to the receiving surface. The caregiver at the head end will move to the side of the HoverJack Air Patient Lift, assuming the safety position. Advise the patient of inflation and ask the caregiver at the foot end to inflate the HoverMat SPU Link. Select the appropriate air supply inflation button for the HoverMat SPU Link model you are using. The caregiver at the patient's side will keep their body firmly against the inflated HoverJack Air Patient Lift during the lateral patient transfer to avoid any HoverJack Air Patient Lift movement. Once the HoverMat SPU Link is fully inflated, the caregiver on the HoverJack Air Patient Lift side will initiate the patient transfer by gently pushing the inflated HoverMat SPU Link at an angle toward the receiving caregiver on the opposite side. Ensure that the patient is centered on the bed or stretcher prior to deflating the HoverMat SPU Link. Stay close to the patient, press the standby button on the air supply to turn off the airflow. Disconnect the air supply hose from the HoverMat SPU Link and raise the side rails when the deflation is completed.